Ovarian cancer. It's a term we've all heard, but it's often surrounded by a lot of confusion and fear. And honestly, that can be a real problem. So in this explainer, we're going to clear the air. We're going to give you a really straightforward breakdown of what you need to know about this disease.
So let's start with a number. Fifth. What does that mean? Well, that's where ovarian cancer ranks as a cause of cancer death in women. Now, it's not the most common cancer you can get, not by a long shot, but it is one of the deadliest. And that's exactly why understanding it is so important. So to really get a handle on this, we've broken it down into 5 key parts. First, we'll talk about why it's known as a silent killer. Then we're going to get into the 3 main types of tumors, and we'll really focus in on the one that's most common. After that, we'll decode the risk factors, what puts you at risk, and, most importantly, we'll talk about ways to actually lower that risk. Okay, so first up, what's the deal with this silent killer reputation? Why is ovarian cancer considered so dangerous? Well, it's for a really simple and kind of chilling reason. The symptoms are often vague and easy to dismiss. So by the time it's actually diagnosed, it's usually in the later stages, which makes treatment a whole lot tougher. This is why awareness is just absolutely critical.
Now, here's something you might not know. Ovarian cancer isn't just one single disease. It's actually more like an umbrella term. Think of it as a family with 3 main branches, and each of those branches starts from a totally different type of cell inside the ovary. Figuring out which cell a tumor comes from, well, that's the very first step to really understanding what you're up against. And this chart right here, wow, it tells a really powerful story. Just look at that. A staggering 90% of all ovarian cancers are what we call epithelial tumors. The other 2, germ cell and sex cord stromal tumors, are way rarer. This single statistic is huge because it tells us exactly where we need to focus our attention first. So let's translate these medical terms, right? What do they actually mean? Well, epithelial tumors, the big 90%, they start from the cells on the outer surface of the ovary. Germ cell tumors, just like the name suggests, come from the cells that actually produce eggs. And sex cord stromal tumors, they start in the connective tissue cells that hold the ovary together and produce hormones. All right, let's dive deep into that 90% category, the epithelial tumors. Since these are by far the most common type, really getting a grip on what they are is key to understanding the big picture of ovarian cancer. But wait, there's more. Even within this huge 90% group, it gets a little more specific. There are actually several different subtypes. You've got names like serous, mucinous, and endometrioid. The main thing to remember here is that epithelial tumor is just the category name, and the most common one of all within that category is the serous tumor. And this is the name you really need to know. High-grade serous carcinoma. This is the big one. It's the aggressive, malignant, meaning cancerous, form of that most common subtype. And tragically, it's responsible for most of the deaths from ovarian cancer. When you hear about ovarian cancer in the news, this is almost always what they're talking about. So what do we know about this specific cancer? Well, a few key things. It often shows up in both ovaries. It's also strongly linked to those BRCA1 and BRCA2 gene mutations you've probably heard of. But here is the absolute game changer. The discovery that has completely changed how we think about this disease. We now believe it doesn't actually start in the ovary at all. It starts in the fallopian tube. This is a huge deal, and trust me, we'll circle back to why this is so important in a bit. Okay, so now that we know what the most common type of ovarian cancer is, the next question is pretty obvious, right? What causes it? Or more accurately, what are the things that can increase a person's risk of getting it? Let's take a look. To make it easier to understand, we can sort all the different risk factors into 3 main buckets. First, you've got the non-modifiable risks. These are things you just can't change, like your age and your genetics. The second bucket is hormonal factors, which are mostly tied to ovulation. And the third bucket is lifestyle factors, things like your BMI and whether you smoke. So how in the world can ovulation increase cancer risk? Well, there's this theory called incessant ovulation, and it's pretty fascinating. Think about it like this. Every single time an ovary releases an egg, it causes a tiny bit of trauma to the surface of the ovary, and that little wound has to heal. The theory is, the more times that healing process has to happen over a lifetime, the more opportunities there are for a cell to make a mistake, to mutate, and potentially become cancerous. Makes sense, right? Now let's talk about that genetic piece, because the numbers here, they're pretty stark. For someone carrying a BRCA1 mutation, their lifetime risk of ovarian cancer jumps up to a staggering 40 to 50%. For BRC2, it's 15 to 20%. And look, both of them are linked directly to that aggressive high-grade serous type we've been talking about. Another condition, Lynch syndrome, also increases the risk, but it's usually associated with some of the other subtypes.
Okay, we've talked a lot about what increases risk, which can be pretty heavy stuff. So it's just as important to flip the coin and talk about the other side. What can you do to lower your risk? What are the protective factors that have been shown to help?
And what's really fascinating here is that the main hormonal things that protect you are basically the exact opposite of the risk factors. Things like using the birth control pill for more than 5 years, being pregnant and breastfeeding, they all lower your risk. And what's the common thread? They all reduce the total number of times you ovulate in your lifetime, which gives more weight to that incessant ovulation theory we just talked about. See how it all connects? Okay, remember that mind-blowing discovery we mentioned earlier, the one about high-grade serous carcinoma actually starting in the fallopian tube, not the ovary? Well, this is where that knowledge becomes incredibly powerful. Procedures like a salpingectomy, which is just removing the fallopian tubes, are now seen as hugely protective. Why? Because if you can remove the cancer's starting point, you might be able to stop it before it ever has a chance to spread to the ovary. It's a total paradigm shift.
So what's the bottom line here? The big takeaway is that ovarian cancer isn't just one single thing. It's a complex family of diseases. And the more we understand about where they come from, who is most at risk, and, crucially, how we can protect ourselves, the more power we have to fight back.
Look, this isn't just a bunch of facts and figures. This information is a tool. It's about empowering you to understand your own body, your own risks, and to have smarter, better conversations with your doctor. So the question we want to leave you with is this. What does this information mean for you? What's one thing you learned today that you can use to be more proactive about your own health?